important to know that time counts when it comes to suffering a stroke. And according to the National Stroke Association, a stroke happens every 40 seconds, and every 4 minutes somebody dies from a stroke. So May is National Stroke Awareness Month, and it was created to promote public awareness and reduce the incident of stroke here in the United States. Medical reporter Rosemarie Beltz is in the studio with a local stroke survivor to share some life-saving information.
So thank you, Andrea. According to the CDC, stroke is the 5th leading cause of death in the U.S. It can happen to anyone at any time. And here in South Carolina, we have pretty astonishing numbers, like the 6th highest cause of mortality here for us. I have Dr. Kotari from Prisma Health, who's a neurologist and stroke survivor, Tanya Spain here to share her story. So what was it like having a stroke at 45 years old?
For starters, scary because I had no idea what was going on. I was asleep and I fell out of the bed, and I went to try to get up and I couldn't move, and I really didn't know what was going on until the paramedics got there, because my speech started to slur and my vision, got blurry, and then I heard one of the paramedics say, "She's having a stroke, let's get her out of here."
So why are we seeing these numbers so high? What are you seeing in your practice and why?
I think the most important factor is the unhealthy lifestyle or unhealthy behavior, and poor diet is the most important contributor. I mean, in South Carolina, we fry everything. Our diet is high in calorie, high in fat content, it's high in salt, and we don't eat that much fiber. So diet is pretty much the most important risk factor, and poor diet means it can lead to obesity, it can lead to high blood pressure, diabetes, cholesterol, heart condition. All these are independent risk factors for stroke. Also, I would say smoking is the big contributor, and in our community, smoking is highly prevalent. Lack of low education, poor socioeconomic status, lack of awareness about stroke and different medical conditions, and limited access to healthcare. I think all these are contributing big time.
So hearing this now with Dr. Kotari here today, what do you know now that you wish you knew then?
I know now to take my health and my diagnosis a little more seriously now. Before I had the stroke, I was not taking my medication like I was supposed to. I was just running with work, and I just didn't take the time to take care of myself.
Right.
I know I wasn't eating the right things, and it just thinking back, I'm like, okay, I have a second chance. I need to do the right thing now.
So hearing this, we know, right, 80% of strokes are preventable.
Right.
And in our world, time is brain, right? Every second counts. So knowing this, how then do we get these numbers to change a little bit for the community?
Yeah, there are two aspects of this answer. One is preventative, like what you can do to prevent strokes, and other thing is what you can do if you or someone in your family or friends is having the stroke.
Okay.
So to prevent this, I think lifestyle modification is very important. Improve your diet. Try to eat more healthy with more fruits, more vegetables. Try to avoid high salt diet. Try to avoid high fat diet. And Mediterranean diet has been proven beneficial. So I always tell my patients to eat healthy and try to do some regular exercise, like even 30 minutes of brisk walking 5 times a week.
Right.
is good for your health. So try to be more active, more physically active. Then if you are a smoker, stop smoking. If you drink alcohol, do it in moderation. Definitely stay away from all the illicit drugs like cocaine, marijuana.
Right.
Like stay away from those things. Try to be more aware or educated about like what the stroke is, like what are the signs and symptoms.
Right.
And
there's that right. Sorry to cut you off there, but that acronym I want to get to, the FAST acronym.
Right. So the acronym is B FAST. So that's the easy way to remember the stroke symptoms. B stands for balance. So where if somebody is experiencing acute onset of balance difficulty, that might be a sign of stroke.
Okay.
E for eye or vision. If someone has acute loss of vision or inability to look at in one visual field, or like in one or both eyes, that can be a sign of stroke. F for face, like facial droop. A for arm and leg. If you have a weakness in the face or arm and leg, that can be a sign of stroke. S stands for speech or language. Speech difficulty or language difficulty, and T stands for time. It's time to call 911. Don't waste a minute, don't waste a second. Just call 911 and try to get the medical attention.
Great. Well, thank you so much, Dr. Kotari, and thank you so much, Tanya. So you heard him, act fast, and we are now tossing to, I was going to say Dr. Gandhi. I just upgraded you to a doctor with your forecast.
I appreciate that. Well,